Welcome, everybody. So we are starting chapter 4, the first 3 months of life. So we get to start seeing more cute baby photos and videos as we go along. But we are kind of separating the first 3 months from the rest of infancy and looking closely at that 3-month period when they are integrating themselves into this new world, right? When they're kind of still in that newborn phase for a few months, which is why we're separating it from everything else. So they're getting themselves established to the world. And the first area that we're going to look at is physical growth. So the baby will gain approximately 6 pounds in the first 3 months and grow more than 4 inches in length, usually. These are just averages. In terms of head circumference, it's increasing more than an inch usually in these 3 months. So pretty significant growth, all of this in total, right? And what comes along with this head circumference is rapid brain development that's occurring as well. So there's some big changes, especially considering their very small size at birth. These numbers are actually pretty significant. So how do we measure body growth? Babies are evaluated using growth charts, so average values of height, weight, other areas of growth. And these averages are compiled by studying large samples of infants. But it's important to also assess the validity of growth charts, right? For example, breastfeeding. Babies who are breastfeeding, it's been shown that they gain weight more slowly. And pediatricians in the past were concerned about potential malnourishment, which didn't make a lot of sense because there's a lot of evidence about the benefits of breastfeeding, less risk for disease, mother-child bonding, rich nutrients, stuff like that. So the conflict was resolved when they realized that they gain less weight because it's easier to control the flow of milk from the breast. So infants feeding this way were voluntarily taking in less milk. So they're not malnourished, just different, right? It's just a different method of how they're feeding and a different way that they are, taking in their food and the way the levels that they control that flow of milk. So a new set of growth standards were created for infants who are breastfed because it does differ from those who aren't. So that's just one example of how it's important to assess validity in terms of growth averages, right? So that's measuring body growth. What about growth of the skull? So the skull is about a fourth of the adult size upon birth, and the growth and shape of the head is largely linked to brain development. So what you see on the outside is tied to what's going on the inside, things we can't see. So providers look closely and track changes in head circumference for this reason, because it's ties to brain development. So in terms of structural issues with the growth of the skull, the bones in the skull are actually separated by soft spots in newborns. And their soft spots are called fontanelles. So they're not fused together yet, the bones in the skull. It takes a little while for them to start fusing together and hardening. So why is this? Well, it allows bones to move in response to pressure. And this plays a role in birthing, as you might have guessed. So it allows the head to kind of mold to fit through that narrow birth canal. It also allows for the brain to expand as it's developing very rapidly in these first few months. So the brain is pushing against these bones and expanding the head circumference. So it's kind of an evolutionary adaptation, these soft spots in the skull in the first few months, to kind of allow the head to mold for different reasons, for the brain growth, and then of course for the birth itself. So you may have also seen some babies before wearing helmets, like this adorable photo here. And sometimes the soft spots on the head will flatten. So they use this special helmets to kind of correct the shape while their skull is still malleable. And this is actually pretty common. One reason for this is flat head syndrome, where the head will flatten, like I said. It's usually not dangerous though, or painful for the child, but they use this helmet to try correcting the shape. And of course, there are more serious issues that could lead to having to wear a helmet as well. But one of the more common ones is this flat head syndrome, which actually isn't dangerous or painful. So We will actually stop here because we have this is probably a good place to stop before we go into the next part. So thank you for joining everyone and talking very briefly about physical growth, but we have much more to come. So I will see you there.